Good morning, guys. We're all sparkly. There's one thing I would not like to be described as. I've been described as lots of things. However, I don't want to be called normal. That sounds awful, doesn't it? I want to be unique. Not special, unique. And we are all unique. That is the beauty of biological individuality. When it comes to testosterone replacement therapy, your protocol will not be identical to the next person's because you do share 23 pairs of chromosomes. Your physiology is similar, but it is not identical. Your requirements, again, are not going to be identical. So you cannot have a one-size-fits-all methodology because we are all unique. Now, it's safe to say we've all made mistakes. Probably a lot of mistakes. And we've paid for those mistakes. However, it is what it is. And you are the person as a result of those mistakes. Now, I should have been a surgeon. I was all set to be a top surgeon. I had the main guy backing me. It was a fait accompli. However, I went to God's kitchen the weekend before. It was an all-nighter. We had an all-nighter, an all-dayer. My mate came in the night before the interview and goes, "Have you prepared your answers to your questions?" I said, "You what? What do you mean?" "Yeah, I'll be fine." I wasn't fine. So, surgery was not in my future. General practice was my future. However, hello Dex, I was rather disillusioned with the model and decided to venture out into, guess what? Testosterone deficiency. So, as a result of my mistakes, I am now here, sat talking to you, hopefully affecting a positive change to you, the individual, and eventually the collective. Now, I do have dreams, aspirations, but my actual focus is the patient. I run a doctor-led clinic. There are no middlemen. There are no advisors. Clinical advice will be given by a clinician, not a patient advocate. So, I have 20 plus years of clinical experience under my belt. Kill me now. Do you know what? It costs a lot to be a doctor. My medical indemnity costs about 12 grand a year. My GMC registration costs probably 460. CQC registration, I think, is about 230 or 280 pounds a month, just so that we can practice. Now, you can go on the internet and just buy testosterone. What harm has ever come from just having testosterone? You can die from drinking too much water. So it makes sense that you should have a considered response to starting testosterone. You should have an understanding of your physiology, pharmacology, but you don't actually need to. What you need to do is place your trust in somebody who does. Quite simple. You shouldn't be that involved in your therapy. Now, it's important to have a basic understanding. So when you do ask your clinician, why are you doing this? They should have sound clinical rationalization for doing XYZ. I've got a hunch. I haven't got a hunch. I can tell you exactly why we are doing what we are doing. Now, there's a reason most clinics consult via the telephone. It's not recorded, is it? He said, she said, doesn't stand up in a court of law. There's a reason why I insist on face-to-face consultations. There's a reason why I document absolutely everything. It's for your safety and my safety. There is an audit trail. So we can look back and go, yes, okay, that was said, that wasn't said. This is what's happened before. This is what happened when we did this. We need to show due diligence. So we are a product of our past experiences. And again, that translates into your testosterone therapy. Now, we've said it before, you are naughty boys. You have done things wrong, whether it's been voluntarily or inadvertently. As I've said before, we should be hunter-gatherer, waking up, going out, exercising to achieve the reward, which is food, and hopefully a bit of nook at the end of the day. So the model is so incredibly distorted. Despite our best efforts, we are not adhering, living by our physiology. So we do have innate drives. We have the wonderful autonomic nervous system that keeps us out of trouble. It allows us to enjoy life, but it is involuntary to a degree. Now, you can manipulate the parasympathetic nervous system slightly through eating, hence comfort eating, hence the chunky monkeys, and also through breath work, which again can manipulate the parasympathetic nervous system, which is what we want. We want to be relaxed. We want to be horny, don't we? So yeah, guys that struggle with their libidos, it tends to be because of stress. We are physical beings in a world full of psychological stress. Now, we go into careers. We go into things that we are good at. I'm good at dealing with stress. Am I? Well, I am and I'm not. So in an emergency, yeah, if somebody just keels over, call me. I have the capacity to be calm, considered in an emergency. Why? Because I go back to basics, which is what we should be doing in life. Lifestyle, diet, exercise, then hormonal health, then medicine. But in an emergency, somebody's keeled over, what should you do? Panic! No, you shouldn't panic. Airway, breathing, circulation. So whilst everybody else around me is panicking, go back to the fundamentals. Now that's learned. So much like you learn the resilience and fortitude to deal with stress in your life, because it's unnatural, ultimately it causes harm. So we've discussed this before, cortisol. The stress hormone is catabolic. It releases glucose, and if you don't use it physically, guess what? Insulin resistance becomes a problem. You become a chunky monkey, type 2 diabetes, etc., etc. And when we talk about life, we talk about what? We talk about balance. Anabolic versus catabolic. If there is too much catabolism, your anabolism will be compromised. So it's train hard, rest well. Work hard, rest well. Work hard, train hard, rest really well. Because you need to. Now, we've said it before and we'll say it again. Hormones follow a diurnal pattern for a reason. Every day is a new opportunity. Your body doesn't care if it's Monday or Saturday. It doesn't care if you've got a stressful day ahead of you, or you're going to party hard, or you're going to be productive. You need to be productive. Rest well. Eat the right amount of food. Paleo diet, baby. That is probably the most healthy diet. You can argue all you like, whatever. So our ancestral diet, predominance of vegetables with some oily fish and meat, makes perfect sense. But does it suit everybody? No, it doesn't, does it? Obviously, because of what? Biological individuality. We are so far removed from nature. Both our physical and psychological health has been compromised. We need to do what? Get back to nature.